Thank you so much for joining us for this panel discussion about diversifying Iowa's cancer control workforce. My name is Sneha Fadke, and I'm a breast medical oncologist and associate professor at the University of Iowa Holden Comprehensive Cancer Center, and I'm also a board member for the Consortium. I'm excited to introduce our panel moderator, Dion Lewis, who will introduce you to the rest of our panelists. Dion Lewis is a committed healthcare professional with a specialized focus on primary care and chronic disease management, currently serving as a clinical health coach at Broadlawns Medical Center in Des Moines, a federally qualified health center. Skilled in dealing with diverse cultural backgrounds, Corey tailors his coaching strategies to address the individual needs of each patient. Inspired by the community he serves, Corey founded the Healthy Project, a public health media venture spotlighting health equity and prevention. Its podcast, ranked among the top 200 U.S. medical podcasts, features global healthcare discussions. Corey also initiated My City, My Health, a conference addressing cultural competency and community collaboration in healthcare. Welcome, Corey.
It's already on? Oh, wow. Hello, everybody. Again, my name's Dion Lewis. So instead of me introducing the panel, I'm going to have them introduce themselves, and we'll get started from there. So we want to start down here.
Yeah. Hello, everyone. I'm Koffi Amegble, and I am a post-baccalaureate researcher through the Holden Comprehensive Cancer Center. I started the program August of this year, and I've genuinely been enjoying my time conducting cancer research.
Hi, everyone. My name is Caroline Powell. I am the Iowa Cancer Consortium's CDC Public Health Associate. And I just have to mention that everything I say today is my own experiences and not on behalf of the CDC. So I'm excited to share with you all.
Hello, everyone. My name is Luzelena Bravo. My pronouns are her, she, and Aya. I have a blue dot. I am new here, so if you guys just see me wandering around, just stop and say hello. I live and work in Dubuque, Iowa, and I work at Crescent Community Health Center in the Health Equity Group with community outreach. Thank you very much. Excited to be here.
Hi, everyone. Can you guys hear me? My name is Carolina Gonzalez. I'm a third-year medical student at the University of Iowa, Carver College of Medicine. I did a research fellowship in advancing health equity throughout the state of Iowa over at UIHC with Dr. Martha Carver. So I'm really excited to be here and kind of share my own lived experiences, and yeah, it'll be fun. Thank you, guys.
Okay, so the point of our discussion today is to talk about diversifying Iowa's cancer control workforce. So my first question to the panel, what does that diversity mean in the context of Iowa's cancer control workforce, and why is it important? Anybody can go.
Yeah, I mean, in my personal opinion, I think having culturally competent healthcare members is extremely important when it comes to cancer control in the state, predominantly because in my personal experience, having lived in Minneapolis, we have a predominantly large Somalian population out there, and through my time interacting with a lot of students in the school district, one common theme would come up, and that was an unwillingness to go and seek help as a result of cultural misunderstandings or just being really seen as a foreigner, as opposed to having the people come to you and meet you where you are in order for you to receive care. And so I think kind of, again, by having diversity incorporated into our, cancer control workers, essentially, we can also kind of like, again, span that bridge that kind of stagnates one's willingness to kind of seek help or even, address questions regarding to their health, even if nothing is really going wrong.
Yes, I'll go next. It's extremely important, especially for us here being in the Midwest, being in a very rural area as a Dubuque. we don't have a lot of medical providers that look brown, that look like me, that look like you, and it's extremely hard for our members and our patients to build that connection and trust. So it comes down to, you know, I've only been in this position for a little bit under a year, and I work with an amazing organization that has given me all the freedom to do whatever I need to do to make connections, and it has worked out in my favor. I work closely with the Black African American community, and I'm not a Black woman, so I had to make my way, get to know different organizations, get to know different individuals in the community that are well respected, that are Black African American, make connections with them and network with them, and it has been an amazing time, and we have made some amazing progress and gotten to do some great stuff. So that's my part.
So I think a few things. So I'll say this. When I started medical school, I had written a personal statement just to be able to apply into medicine. And I had talked about how I felt very strongly that any kind of workforce should be reflective of its population. So if you have a 10% this amount of race, I believe that medicine should have that X amount. And the reason I had said that, it wasn't because I was trying to advocate for kind of doing a checklist, like, oh, we're meeting diversity, great. It was more of a, you know, when you think about cancer, it affects everyone. It doesn't really discriminate. And so for us to be able to identify disparities and gaps, you just need those people to also be at the table. And so I think when we talk about diversity, we're not just talking about racial or ethnic diversity, but we're talking about patients from rural communities also having, you know, jobs like within the university, within academic centers, within even here. So for me, I just think it's just, we don't know what we don't know if we don't have different types of people at the table. So I hope that people can kind of see that. You know, it's not something political. It's just, we just want everyone to be at the table. Everyone from Iowa has to have a place so that they can get their piece and their say. So that's kind of where I come from when it comes to diversity. So
I'll just echo that. I'm from Queens, New York, the, I believe, most diverse place in the world. And so coming here, I think it was a little bit of culture shock. Yeah, thank you, yeah. And I think just, you know, normalizing that different folks are living here and have been living here is so important. And, you know, I like to tell people, I'm like, when I get off the metro station or when I enter a doctor's office, there are signs in 5, 6, 7 different languages already. And so I think, like, that would be the ultimate dream, in a sense, just seeing it from the moment you walk into the office, from the moment you leave, like at all levels of leadership, whoever you're seeing on like a care team, feeling that sort of connection and representation is super important.
Yeah, to kind of expand on that, I think it's also to, really consider the demographic reflection inside the workers, but also having people from dramatically different upbringings, I think, is important too. I think we oftentimes neglect the impact of growing up first gen or growing up low income, or again, having, you know, non-traditional circumstances that led you to where you are. And I think those type of individuals also bring a lot to the table in that they can leverage their vulnerabilities and, you know, the things that kind of empower them to reach where they are, to kind of span that trust gap between themselves and the communities they're trying to serve.
So I'm gonna start this next question with you as well. So what I heard just now was, one, you said cultural competency, which is also important, simply because if we don't have cultural competency, that leads to mistrust in the healthcare system, right? Also heard representation is important as well. These are not new things, right? So that leads to, you know, my second question. You know, what are some of those key barriers or challenges to achieving greater diversity in the field within the state? And there are a lot of people here that are not originally from Iowa. So what are some things that we can do to get more of a representation of what Iowa is becoming to be a part of, you know, this workforce?
Yeah, I would start off by saying that I think personally we need to start young. I think mentorship is extremely important when it comes to navigating the healthcare landscape and even trying to, like, again, have an impact on the health of your family or those in your community. So U of Iowa, for instance, has programs like SHPEP, the Summer Health Professions Education Program. And those summer programs provide exposure, they provide meaningful interactions with healthcare providers inside the U Iowa hospital and clinics. They allow you to shadow, mess around with the instruments they use in order to provide care with physicians, essentially. And I think, programs like that are extremely meaningful because, again, you yourself are in this space where you could potentially be making the impact. And not to mention having, mentors that reflect your complexion and your background and whatnot can also kind of leverage their position to kind of give you more of the nuances of what it is you'll likely encounter and the barriers you'll have to overcome in order to make a meaningful impact and find the success you're looking for in a lot of these spaces. For instance, I, for one, felt like I benefited from organizations such as Black Men in White Coats, who held virtual meetings over the pandemic, essentially. And it's a congregation of African-American physicians from a plethora of different locations across the country and a plethora of different specialties. And through their online Zoom sessions, they kind of, again, provide a space of their vast knowledgeability to, the subset of people that are oftentimes kind of kept out of the conversation and are often kind of hesitant about even inquiring about what it is that it requires to get into those levels of professionalism.
I can go next. I was just, by show of hands, who here drives or has a car? Yeah. When I moved to Iowa, I did not know how to drive. And I think, So I think one barrier is transportation. And I think when you're like in hiring practices, I'm sure like most people don't even think about that as a barrier because everyone has a car or has been driving since they've been 14. So I think that's a really interesting way to think about it because I think we often think of mobility and transportation from a patient side, like how are folks getting to treatment if they can get to treatment, but to think about it from a worker side, like when you're interviewing someone, not letting that be a barrier or an automatic disqualifier, I think would be really important, and just meeting people where they're at.
Well, we have been doing, I have been doing over in Dubuque, I've been partnering with the Black Men Coalition. I have also been partnering with the Phi Beta Sigma brothers that have been helping me as well. And they have helped me and given me space to be able to set up my table. I have been able to go to their meetings, and I was so surprised just to see so many different men that just come up and have so many questions or just don't know. And it always goes back to I don't want nobody touching my butt. And the first thing I tell them, it's like, that's not the way it will go. It starts with education. It starts for you to come in. We can have a conversation in office with the provider, establish healthcare, get insurance. It's just and also the churches, the Baptist Church in Dubuque has been very welcoming to me as well, and making my footwork around Dubuque, Iowa, one step at a time has been amazing.
Corey, I think if I'm understanding correctly, I think your question was what can we do or what are some barriers to having diversity, is that correct?
In the field, yeah.
Yeah, I think, I can speak from my own experience. I'm not from Iowa. I'm actually from San Diego, California. And when I came to medical school, I didn't really have any intentions of staying in Iowa. I thought, I'm just going to do medicine, I'll do what I have to do, and then I'll just head somewhere else. And what really changed for me is I found a really good support system here, and I was very open to Iowa. I was very open to the patient population, and I found a very inclusive environment. I felt very supported, and I felt that, people really cared what I had to say. And I think when it comes to there are many barriers, I will say, for many minorities, and I do acknowledge that, but I do think that it's important to create an environment that makes them want to stay here, if that's something that we value. So, for instance, at the University of Iowa, we had a paper that came out that we didn't have a lot of Black students, and the reason being that when they looked at Black female students in particular, there weren't any salons where they can get their hair done, which I thought was really interesting. There was nowhere they could go, so they had to drive 2 hours to go to Chicago or whatnot. And so little things like that, or there weren't any Black churches or any restaurants that they could were familiar with the food. And so, sometimes I think about if we value diversity and we just want different types of people, sometimes it's just a matter of accommodating and just inviting them to the table, if that makes sense. I do agree as well that mentorship is really important and networking. I would argue that that's probably one of the most important things, because at the end of the day, there are gatekeepers. There are people who decide who gets hired and who doesn't. And so just making sure that, we want people that look different. I think that also is really important. So that would be my take on it.
No, I like how you brought up Black men in white coats. And when I think of initiatives like that, you see them in big cities, but you don't really see them in Iowa. And I think that's so important to get to our kids. But there is one for anybody that's interested. Big Brothers Big Sisters does have the Pathways program, which I'm a mentor of, where they can follow somebody within a profession. And I think getting more of our providers in some of those, even though we know providers have busy schedules, giving some time to kind of, be there for some of these kids, let them know there's another way than what we see in some of our inner city schools where, it's basketball, it's sports, right? There's another way where you can support yourself and get out there. That leads to my next question. There's the Iowa Cancer Summit. There are a lot of initiatives, right, that are doing great work. Shout out to Iowa Cancer Summit, Iowa Cancer Consortium. But how can we promote inclusivity and diversity in cancer and control organizations and initiatives across Iowa? Some other ways that you guys can think of.
For me, it has been realizing that in the position that I took, I had to take a step back and get to know the history, the medical history. It took for me to understand where the barriers, where the struggles are in the population that I serve. Not only that, but it also was educating nurses, doctors. They, as well as being in such a rural area in Dubuque, a lot of the providers grow up in small towns. They never have worked with Latino community. They've never worked with Black African American community. So sometimes that right there also leads to a lot of issues. So just educating the providers has been such a positive thing, and it's been amazing just to see that a lot of our providers are open-minded and willing to want to learn more and whatever they can to help all the populations we can.
I would say that I think it starts with the leadership. I think the more we have representative leaders that are spearheading these organizations, I think the more it kind of trickles down to the workforce itself as well. I think by fostering and demonstrating, leaders from different communities and different backgrounds all collaborating for the same mission, which is to kind of reduce the incidence rates and, again, try and improve the survival outcomes of cancer patients, it's going to require a massive collaborative effort. And if everyone just kind of stands on their own corner, I think that really poses a big barrier. And something else that came to mind too is I think a lot of times organizations are very disconnected from the populations they serve too. I think a lot of times, due to the offices and the degrees and whatnot, there's like this cultural rift between the communities and those that are intended to serve them. And unfortunately, again, that can oftentimes mean to them, you don't, then you probably will never understand where it is they're coming from and the personal battles they're facing. And so I think, again, it kind of requires a bit of, more outgoing efforts from the leadership and the people at the very top to try and, again, make themselves like community pillars, not just, the latest executive inside the organization.
I had a really great mentor. We keep talking about mentorship, and that is so, so key. I had a great mentor at United Way Worldwide when I was on their labor engagement team. And she would always say, you don't know what you don't know. And I think just that really is the key when it comes to educating folks. Like, they really don't know what they don't know. Like, not everyone grows up in a big city and can meet different people from different walks of life. Like, sometimes that happens later on, and that is okay if you come to it with an open heart and an open mind. And then also just, I think paid internships are a big part of inclusivity, because you should be paid for your work. Like, volunteerism only gets you so far, and especially if you're targeting younger folks who are getting degrees, they have classes and work, and they have to pay for tuition or family obligations. Like, there's so much going on with a person beyond just being a worker in the cancer control field, and I think just taking that into consideration will ultimately make the field more inclusive. And also just education isn't everything as well. Like, lived experience is also super valid, and one should not cancel out the other. We should look at it as a whole.
To add to that, I do think, and I think we've talked a lot about kind of structural things we can do. We talk about summits and things like that, and I think those are all great. I would also like to add that there are things that we can do at the individual level that are very simple, that I think go a long way. Very similar, I was gonna go to community college when out of high school. And I had one teacher at that time who told me, you can actually go to a 4-year college. That's actually an option. And I thought, really? I can do that? And they were like, yeah, you can actually go to college. I applied to one college, which I did get into. And I do believe that changed the trajectory of my life. I ended up going to medical school, all these other things. And it only took one person to tell me that I could do that. And so I think oftentimes when I see the lack of diversity, sometimes it comes from just people discouraging you, that's really hard. Or getting into medical school is really hard, or getting into that, it's really hard. I don't know if you can, and so there's a lot of that, and sometimes it's implicit. It's not something that people are trying to be mean, but what it ends up doing is you do end up discouraging people, especially see it a lot in rural communities where they're like, you can actually go to the University of Iowa. They're like, really? I'm like, yeah, that. There's nothing stopping you from submitting an application. You can do that. So sometimes those little things actually do go a long way, and I think that goes back to mentorship, but just even when you're talking to someone, when they tell you about their dreams, you can just say, yeah, give it a shot. You might fail, but you can still try, and I failed at many things, and that's okay. But I think those little things just, they play a big role. So I think we can't ever forget that.
Yeah, so Caroline, you brought up something earlier, and you said that in New York, you can go to the hospital, and there would be something in many different languages, right? And I feel like that's so cool for somebody when they're going there. They're probably nervous and they don't know anybody, and they can see something that is comforting to them. So I would love to ask you guys, what are some other potential benefits of a more diverse workforce in the fight against cancer in Iowa?
Okay, so some of the in the workforce for the diverse is just having the time to sit down with the patient and giving the patient the time to listen to their story, and be proactive with their story. I think that starts off with making just a difference there, making the patient know that they are heard, they are listened, I am here, I do care. And it just goes back in the position that I hold is educating the providers, letting the providers know, like, hey, they have these obstacles, or the reasoning why they do not want to come in for the routine checkups it might be a car transportation barrier, or it might be the fact that history's ugly in the medical world for some of our populations, and they want to stay as far away as they can for as much as they can. And when they do come in, it's most of the time it's when it's already a little too late. So once again, I like to focus on just the education and getting to know our history, our medical history. Even though that it's not the most prettiest, we have to acknowledge it, and we have to continue to talk about it and move forward.
I can add on. So my background is in food systems work, and I'm also Trinidadian. So like when I think about like comfort, I think of food. And there's this podcast, it was from a cancer organization, but they gave a really beautiful example of a Korean doctor who was the only one who could translate for an elderly Korean man undergoing cancer treatment. And the only thing he wanted was like this porridge from home. And so I think it goes beyond just like, it's not only education, but also while they're going through cancer treatment and care, like having that familiar face and someone who can relate to you like on a deeper level is also just good mentally, like while they're going through that. So
yeah, I think there's something to being able to speak to somebody without saying words. Like you already know how I feel.
Yeah.
So I don't have to explain to you why I want this certain food. I can just say, yo, I need this, and you're like, I got you, right? And I already understand. And I think there's something comforting in that for people. And I want to add to what someone said earlier as well, and I would love to get your thoughts on this. When it comes to this work, I know we talk a lot about providers, right? But there's more than just, we have community health workers on here that can provide that type of work. So I think in many aspects of kind of the cancer world, there are social workers. There are so many different areas that can be a part of that care team for somebody that we can kind of promote and help, either anybody, when it comes to, something like this.
And I just wanted to kind of add, going off of your point, I think having a diverse workforce also provides diversity of thought and how to undertake complex problems. And one of those problems, to me, I think, is providing holistic care to the patients as opposed to just the cancer treatment itself. Because again, I think, it's more than just, going in for, the rounds of chemo and the rounds of radiation. I think, there's parts of yourself that, you kind of lose in the process. And so kind of having your well-being, whether it be mental, emotional, spiritual needs being met too, I think can very well provide that sense of completeness or get you closer to it than you once were when you first received news of your diagnosis. Earlier this year, we had the American Cancer Society come and present at the University of Iowa, and we kind of learned of some initiatives to kind of, again, take into account physical wellness into the cancer, for the cancer patients essentially. So maybe having exercise groups, for instance, kind of having communities amongst those undergoing a similar battle can also kind of boost morale and maybe, again, allow more people to, hold on longer in the fight than what they currently do.
Thank you, sir. So last question. This is maybe, you may not know, but hey, you do research, and this may be a great question for you. How do we measure progress in diversifying Iowa's cancer control workforce? And what are some benchmarks we should aim for?
So one thing that immediately came to mind was essentially seeing an increase in the numbers of patients that come in for their screenings that are of marginalized backgrounds. I think the more they know, they can trust you and they can be vulnerable with you as to, the activities or whether it be like, what they're consuming, their level of activity outside of, work, the more they can kind of be vulnerable with you about these things, the more, again, like you can kind of build that bond to kind of encourage them to, take care of their health. And by doing that, coming in for early colorectal screenings or prostate screenings or, ovarian mammograms, stuff of that nature. Because again, a lot of times, I think particularly for African American males like us, we're predisposed to dying from a lot of cancers. And again, a lot of these deaths could have been preventable had these people been able to go in and actually have had like, a test run. So if we can kind of, again, start making that, little dribble kind of turn into more of a faucet turning on and making sure, again, these people, they know like, hey, I have a family predisposition for this. And some people may not even know. So again, kind of taking into account, again, like, what are the relative trends we're seeing inside these populations and how is it we can kind of encourage them to be a bit more vigilant about their medical needs, can dramatically improve, like, again, like how it is we go about preventing cancer in the first place. And if we do, catching it so early on, we can improve the likelihood of survival.
Another way that we have been able to help at Crescent Community Health Center has just been, once again, having those one-on-one conversations, but also as me working with community health workers, it's just hiring the community health workers that represent the diversity of the population we're trying to serve. But getting to know the populations, like my story with what I do, I call myself a braided sister because I am Latina, but I work close with the Black African American community. And I didn't really know much about the Black African community until my partner, my fiance, is a Black man. And his father died from cancer. My grandmother died from cancer. And when I was working as I work at Crescent Community Health Center, and the Black population, Black men that I see at Crescent, there's so many of them that are coming in with symptoms that are already too late. And it's just because the lack of conversations, the lack of education, the lack of mentors that look like them in the community that are having these tough conversations. This is why it's so important that we take the time, especially for me. I go to the barbershops, I go to the brunches, I go to the colleges, and I go in there, and sometimes my partner comes with me because I can only do so much. But when they see the big brother there, they open up. I become a welcome image. And it's not only has just been my work, but it's also been just the help of the community that I have in Dubuque, Iowa. And that has helped me out. And I apologize if I seem nervous, but I'm still learning. I'm learning. I'm a sponge right now, and like I said, I've taken a step back to get to know the history of why our Black population has such a struggle with preventative care, with cancer treatment, and it has left me in shock. And all I can do from now is move forward and continue to educate others. And it has also been a catalyst for me to go back to school, as now I'm going back to school for public health administration, because once again, in leadership, we don't have anybody that represents us, that looks like us, that has a voice like us. So it's been a learning curve, but I'm so amazed by the support that I have from the community back home. And please, as this is the last question, right? Yes. Yes, if anybody out there wants to also link and network with me, or I am willing and I want to learn. I'm in the era of learning in my life right now. So please reach out to me and let me know if you want to link up and network together.
So as far as measuring just progress, as far as how we're doing with diversity, I think it's important for any organization, whether it be here or just, any institution to first make a decision about what does diversity look like within our organization. And again, I think that the whole concept of diversity is not restricted to just ethnicity or race. I think it's really just you have to look at it as a whole, like what is it that we're looking for? What do our patients need? Does our organization look like the patients that are coming into the clinic? And I think that's the very first thing. And then once you've decided collectively what that's gonna look like, I think from there has to be a way of measuring. So for instance, one of the things that I notice a lot is sometimes there's a high turnover rate. Do you see that there is a difference in patients that maybe live farther from where you work, that are they're leaving their jobs more frequently? So I do think there has to be and it's hard because you don't wanna single out people. And I think that's the biggest challenge that I see, but there has to be a way of kind of knowing, whether it be through listening sessions, like, are we creating an environment that is inclusive of everybody? Does everyone feel like they have a seat at the table, that they're a part of something? So that would be my take as far as measuring things. And since this is the last question, I would like to just add that Iowa's a very diverse place. I mean, it's full of diversity, and it comes in many different shapes and forms. And so I don't think we ever have to think that, we're not diverse already, because I think we are. But I think sometimes we get a little bit stuck in what that looks like. So I just want to put that out there.
Yeah, and I had one more point to add, and that was essentially, I think a lot of times the communities we're trying to serve often feel like people from the outside are trying to change us. And I think we need to kind of change that narrative to how can we inspire the community members, and especially those that are pillars in those communities, to kind of become the leaders and the people that kind of rise into positions of leadership to kind of distribute this knowledge and to become, like, some of the most important contact people within the places that they locally live. Because I think, you kind of brought up the idea of transportation being a barrier. So again, like, if we have, these individuals acting as like seeds inside their communities, and we continue to, again, pour into those individuals, hopefully they can ultimately become mentors themselves in the future and kind of create these branches of, again, highly knowledgeable and highly approachable people that have always stuck around and don't just come and go whenever it's time to, do an annual or yearly, checkup on something. These people are always there looking out for your best interests. So that's one thing I think, the African-American community in particular, would be very capable of doing.
That's good. That's good. Awesome. Thank you so much for our panel. I really appreciated you guys giving your insights and value. We do have some time if anybody had any questions for our panel. Back here. Oh, I'm about to get up, ain't I? Oh, there we go.
I just have a quick comment. I'm an immigrant myself. I come from a very tiny island in the Mediterranean called Malta. It's just 18 miles by 9 miles at its widest, to show how tiny it is. We do have a Latin culture there. As far as I know, we are only 8 people from Malta in Iowa. So forget about somebody who's really knows your culture or your background as a healthcare provider. And I'll talk a bit. For the cancer field, it's the same, but for the mental health field, for example, it's even worse. There's already a shortage of providers. Forget trying to find somebody who has a deep knowledge of your culture, etc., who can provide you services. So having been to a number of healthcare providers, and of course, no one looks like me, nobody is from my culture, nobody has an understanding of my background or where I come from. It is so important. How many healthcare providers are there in this room? A show of hands. Okay. It is very, very important to make somebody feel welcome and we touched about this, we didn't name it, rather than be culturally competent, be culturally humble, cultural humility. Learn, ask questions. Do not assume when a patient comes into your office. You don't know what the physical and emotional hell they have been through, okay? Especially if they come from minority groups. Be humble, ask questions, and be willing to learn, because that is how you build trust. I'm sure I'm saying nothing new here, but in my journey, I found it to be so, so, so important. Be humble, be willing to learn, And who knows, maybe if they visit their home country, they might bring you a gift as well back, you know? Be willing to learn. That is, it's hard. It's very hard to go in front of somebody in the first place and, you know, disclose stuff that you wouldn't disclose to anybody else. It's even harder to do it from somebody who has no understanding of your background and culture. So please, 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 be willing to open your hearts and minds and learn. Thank you.